Most doctors won't tell you about bioidentical hormones because it's not their area of expertise. I'm Dr. Malaika Woods, and I'm one of the few who is a board-certified OB-GYN, certified in functional medicine, certified in hormone optimization, and board-certified in obesity medicine. You know what's interesting? I see women in my practice who figured out incredibly complex things in their lives. They've navigated career transitions, raised families, built businesses, managed teams through crises. But their body, that's become the one thing that doesn't make sense anymore. If you're in your 40s or 50s and you're exhausted, gaining weight, can't sleep, and don't feel like yourself, this video could change everything. I'm going to show you exactly what bioidentical hormones are, how they're different from synthetic hormones, and whether they're right for you. Quick note before we start. If you're new here, I post videos every week on root cause approaches and natural solutions as it relates to hormone health, metabolism, gut, and thyroid function, all the things that are typically not discussed in traditional medicine. Hit subscribe if you want to stay in the loop. I promise I'll make it worth your time. Now let's dive in. So what exactly are bioidentical hormones? The term bioidentical means the same molecular structure as the hormones your body naturally produces. Technically, we should call them isomolecular hormones versus the term bioidentical. These are not synthetic, they're not foreign to your body, they're exact replicas of your own hormones. Think of it this way. Your body has a specific key that fits a specific lock. Bioidentical hormones are the exact copies of that key. Synthetic hormones, they're similar but not identical. Like trying to use a slightly bent key in a lock. It might work, but not quite right, and you may not ever get into that room. The most common bioidentical hormones are estradiol, which is the primary estrogen your ovaries produce, progesterone, crucial for sleep, mood, and balancing the impact of estrogen. Testosterone. Yes, women need testosterone too for energy, libido, muscle mass, and mental clarity. Also DHEA. This is a precursor to testosterone, and this hormone supports energy and immune function. Many of these hormones are typically derived from plant sources like yam or soy, and then modified in a lab to match your body's hormones exactly. The key difference between bioidentical and synthetic hormones is how your body recognizes and uses them. Your cells have hormone receptors like locks waiting for keys. Bioidentical hormones fit those locks perfectly because they're chemically identical to what your body makes. Synthetic hormones, they're chemically altered so that they can be patented and sold. That small change means they don't fit your receptors quite right, the synthetic ones, which is why they often come with more side effects. Quick question before we continue. Have you gotten pushback when you ask for your hormone labs to be drawn? Drop a comment below. I want to hear your story. I read all the comments. Now let's talk about the difference between bioidentical and synthetic hormones, because this is where a lot of confusion happens. Synthetic hormones like Premarin, Prempro, Provera, these were the standards for decades. Premarin is actually made from pregnant mare's urine. Yes, that's why it got the name Premarin. And Provera is a synthetic progestin, not a natural progesterone. These were the hormones used in that Women's Health Initiative study back in 2002. That was a study that scared everyone away from hormone therapy. And yes, that study showed increased risk of breast cancer, heart disease, and stroke. But here's what most people don't know. That study used synthetic hormones, not bioidentical. And the women in the study were older, many starting hormones 10 plus years after menopause, which is not what we do in the real world. And we now know that carries an increased risk. Bioidentical hormones are chemically identical to what your body produces. They're metabolized the same way, they interact with your receptors the same way, and the research shows they have a different safety profile. Here's a quick comparison. Synthetic hormones, chemically altered and able to be patented and sold. Bioidentical hormones, identical to your body's own natural hormones. Synthetic hormones are often in the oral formulation only. Bioidentical, we have multiple delivery methods like creams, patches, injections, pellets, troches. Synthetic is oftentimes like a one-size-fits-all dosing, whereas bioidentical, we can customize the dose very specific to the individual. Synthetic showed an associated higher risk of breast cancer, heart attack, and stroke. Bioidentical has a completely different safety profile. We don't see those risks of breast cancer or heart disease. Provera, which is a synthetic progestin. Then you have progesterone, which is bioidentical. Premarin, which is pregnant mare's urine. It's actually a combination of 10 plus different hormones. Estradiol is your bioidentical estrogen. I'm not saying synthetic hormones are evil. For some women, they work fine. But if you've tried them and felt terrible, or if you want a more natural approach, bioidentical hormones are worth considering. Now, if you're finding this helpful so far, give this video a thumbs up. It helps more women find this information, and so much information is lacking. And stick with me because we're about to talk about the science and safety data that you may not have heard before. Let's talk about safety because this is the biggest concern I hear. Look, I know many of you have done your own research, which I think is great. I call you all the true health seekers, and you're my kind of people. So let's talk about what the actual research shows, not the fear-mongering headlines, but the real data. The 2002 Women's Health Initiative study. This is a study that scared everyone. I always say I imagine all the doctors were just ripping up their prescriptions at that point. But this study had some major flaws. It used synthetic hormones, Premarin and Provera, not bioidentical. Another issue is that these women were older, average age 63. Many of them were 10 years past menopause. This is not what we typically do. We typically start hormones for women in their 40s. Another issue is that they only used oral estrogen, which increases clotting risk more than the other modalities. What newer research shows about bioidentical hormones, and again, this is a high-level overview, okay? Estradiol, the bioidentical estrogen, and even synthetic estrogen are associated with up to a 50% reduction in breast cancer. Studies also show that the non-oral forms of estradiol, such as patches or creams, does not increase stroke or clot risk the way oral estrogen does. Also, progesterone bioidentical is safer than Provera, the synthetic progestin. There's a French study called the E3N study that showed that bioidentical progesterone combined with estrogen did not increase breast cancer risk, while estrogen combined with progestin synthetics did increase the risk. Also, timing matters. There is a window of opportunity. Starting hormone therapy within 10 years of menopause or before age 60 is associated with reduced risk of cardiovascular disease. In some studies, 40 to 60% reduction. The delivery method matters as well. Non-oral forms of estrogen have lower clotting risk than the oral hormone. Individualized dosing matters. Bioidentical hormones can be customized to your specific levels, reducing the risk of over or under dosing. The bottom line, bioidentical hormones, when prescribed appropriately and monitored properly, have a favorable safety profile, especially compared to doing nothing and suffering through menopause symptoms for decades. Are there still risks? Yes, every medical intervention has some risk, but for most women, the benefits far outweigh the risk, especially when we're talking about quality of life, bone health, brain health, and cardiovascular health. All of those things are significantly improved in women on hormone replacement versus women who are off when you follow them over time. Now, if you're dealing with sleep issues specifically, waking up at 3 a.m., can't fall asleep, exhausted but wired, I have an entire video breaking down how hormones affect your sleep and exactly how to fix it. I'll link that in the description and in the cards above. Make sure you watch that next. So who actually needs bioidentical hormone therapy? Let me break down the signs. You might be a candidate if you're experiencing perimenopausal symptoms. Again, it can start in the late 30s, but irregular periods, heavy bleeding, hot flashes, night sweats, trouble sleeping, waking up at 3 a.m., brain fog, memory issues, mood swings, anxiety, irritability, low libido, vaginal dryness, weight gain around the middle, fatigue that doesn't improve even with sleep, joint pain, muscle aches. All of these things can be related to perimenopause, menopausal symptoms, and you might be a good candidate. So I mentioned the perimenopausal symptoms, and that could roll right into menopause, which is 12 months without a period. So you can have all the perimenopausal symptoms, and then some things are more severe, like bone loss, osteopenia, osteoporosis, skin changes, hair thinning, vagina becoming more atrophic or thin, painful intercourse, cognitive decline and memory issues, increased cardiovascular disease risk. Again, all of these things can be even worse once you hit menopause. Here are some other situations where bioidentical hormones may be helpful. Someone who's gone through surgical menopause, meaning they've had their ovaries removed, often with hysterectomy. Someone who's gone through premature ovarian failure, like they go through menopause before 40. Those with thyroid issues, which also can impact hormones. If you've got chronic fatigue or adrenal dysfunction, all of these things may be improved with bioidentical hormone replacement therapy. Here's the key. You don't have to have every symptom to be a candidate. If your quality of life is suffering and your labs show declining hormone levels, you deserve treatment. And here's what most doctors won't tell you. Normal lab ranges are based on averages of all the sick people coming in and out of the lab. It's not based on optimal levels. Your estradiol might be normal for a 55-year-old woman, but that doesn't mean it's optimal for you to feel your best. That's where functional medicine comes in. We don't just look at whether you're in range, we look at whether your levels support your health goals and your quality of life. If you're realizing you might be a candidate for hormone therapy and you want to learn more, I have a free community called The Natural Hormone Fix, where I support women on their peri/menopause journey. I go live in the group regularly, answer questions, and it's just a great group of women supporting each other. I'll add the link to join in the description. All right, so you're thinking bioidentical hormones might be right for you. So what's next? Step 1, find the right provider. Not all doctors are trained in bioidentical hormone therapy. You need someone who specializes in functional or integrative medicine, someone who uses comprehensive testing, not just basic lab panels. You also want to look for someone who understands bioidentical hormones specifically, someone who will listen to your symptoms, not just look at your labs, who will monitor and adjust your treatment over time. If your current doctor dismisses your symptoms or says your labs are normal, you're fine, it may be time to find someone who specializes in hormone health. Step 2, get comprehensive testing. A basic hormone panel isn't enough. Here's a few of the things you need: estradiol, progesterone, both free and total and bioavailability, DHEAS, the thyroid panel, which includes TSH, total T3 and T4 antibodies, cortisol, a 4-point saliva test, not 1 point in time, vitamin D, B12, ferritin, inflammatory markers, cardiovascular markers. I can go on and on there. And if you'd like a list of the labs I order, just drop in the comments and we can share that with you too. Step 3, discuss delivery methods. And I'll share a few forms. This is just my opinion and my experience. There are creams and gels that you apply to the skin. Not my favorite because these can be absorbed differently. It can be a little bit more messy. And particularly with progesterone, you can't get a good blood level using it as a cream. There are patches that you can get, which gives you a nice steady state of hormone delivery. There is also a troche. It's like a square wax-based preparation, like a throat lozenge. You just hold it in your mouth. I think that's also a very good option. What I like about that from the bioidentical standpoint is that we can get multiple hormones in one delivery method. So you're not taking a patch, a cream, and a pill. We can simplify it. There's also injections, which is something that is actually quite popular in my office. You can do injections of estrogen and testosterone. And for women, we do that every 2 weeks. For men, we do it weekly. And then there are also pellets. Pellet is like a little compressed powder of hormone, like the size of a Tic Tac or smaller. We place those under the skin via a little procedure in the office. So in the upper outer buttock area, we numb it first, then we place the pellet after making a little tiny incision. And those pellets give you a nice steady state of hormone over a nice period of time. I really think that's the best delivery method, but here's something that may surprise you. I don't start anybody on pellets, though I think it is one of the best delivery methods. And the reason being is because for those of you who have heard horror stories about pellets, I think the mistake that was made is that someone is started on hormones for the first time, via the modality of pellet. I think you need to start something that's easily reversible first so that you can understand what kind of side effects might a person have, and then you can decide to move on to pellet once you understand how they're going to be impacted by the hormone. That's very important, but that's kind of a rundown of the different options. So each of these methods have their pros and cons. Your provider should help you choose based on your lifestyle, your preferences, and your health history. If you would like me to take a deeper dive into the different forms of hormone replacement, just let me know, type options in the chat, and I'll shoot another video in the future covering that. Step 4, start low, go slow, and monitor. Hormone therapy isn't one size fits all. You'll likely start with lower doses and adjust it based on how you feel, what symptoms are improving, what symptoms have not been impacted yet, follow-up lab work, are the levels optimal? One thing that I tell my patients all the time is that the lab tells part of the story and they tell part of the story. We're also looking for any side effects that we need to manage, and it could take 3 to 6 months to find your optimal dose. Be patient with the process. Step 5, optimize lifestyle factors. Hormones do not work in isolation. To get the best results, you need to address sleep, getting 7 to 9 hours, stress management. High cortisol disrupts all the hormones, nutrition, blood sugar balance, adequate protein, getting in good healthy fats, moving your body and exercise. Strength training is so important for the perimenopausal, menopausal woman. They say muscle is the new currency of aging. And then we can't overlook your gut health because your gut actually helps to metabolize estrogen. Think of bioidentical hormones as one piece of the puzzle, not the entire solution. Now I'm curious, what's been your biggest challenge in finding a doctor who takes your hormone concerns seriously? Drop a comment and let me know. I want to hear what you're dealing with. Next, let's talk about what to actually expect when you start bioidentical hormone therapy, because I want you to have realistic expectations. In the first 2 to 4 weeks, you might notice improved sleep or energy first. Some women feel better almost immediately. Others need time for their levels to optimize further. You might experience some temporary side effects like a little oily skin, some breast tenderness, some light spotting as your body adjusts. By 3 to 6 months, most symptoms should be significantly improved. Hot flashes and night sweats are typically reduced by 80 to 90%, so essentially gone. Energy and mental clarity improve, your mood stabilizes, the libido is starting to return, and your weight is finally starting to drop off. It's not automatic, it takes time. Long-term benefits like 6+ months later, there's bone density protection, there's cardiovascular risk reduction, there's cognitive function preservation, meaning the risk of dementia, Alzheimer's goes down, skin, hair, and joint health is improved. Overall quality of life enhancement. Here's an important reality check. Bioidentical hormones are not a magic pill. They won't automatically make you lose weight, though the weight loss will become easier. Bioidentical hormones will not reverse decades of poor lifestyle habits, and it won't fix relationship issues or life stress. It doesn't work the same for everyone, but what they will do is give your body the tools it needs to function optimally again. They level the playing field so that your efforts, like eating well and exercising and managing stress, actually pay off for you. Think of it like this. You've been trying to drive a car with no gas. Bioidentical hormones fill the tank, but you still have to steer. If you're in the Lee Summit, Kansas City area, or anywhere in Missouri, Kansas, or California, at the time of this recording, we're adding more states. And if you're ready to explore whether bioidentical hormones are right for you, my practice specializes in exactly this. I offer a root cause, comprehensive approach that includes full hormone testing and personalized treatment plans. You can find the link to schedule a consultation in the description below. My team and I would be honored to help you feel like yourself again. Here's what I want you to take away from this. You're not crazy. You're not dramatic. You're not just getting older. Your body is going through a massive hormonal shift, and it's completely reasonable to want support through that transition. Bioidentical hormones aren't right for everyone, but for many women, they are life-changing. They give you back your energy, your mental clarity, your sleep, and your sense of self. and you deserve that. You spent decades taking care of everyone else. It's time to take care of you. So here's your action plan. Number 1, find a provider who specializes in bioidentical hormones. Number 2, have an honest conversation about your symptoms and your goals. Number 3, get comprehensive hormone testing. Number 4, start treatment if it's right for you. And number 5, monitor, adjust, and optimize. And remember, this is a journey, not a quick fix, but it's a journey worth taking. If you found this helpful, make sure you're subscribed because I post new videos every week on hormone health, thyroid function, weight management, functional medicine. Drop a comment below with your biggest takeaway or any questions you have. I read every comment and I'll do my best to answer. And if you know someone who's struggling with hormone issues, share this video with them. Let's help more women get the answers they deserve. I'm Dr. Malaika Woods, and I'll see you in the next video.